You did it. I can record.
Woo!
Yay.
Go us. Uh,
All right, so I guess we can just go through the questions, kind of like we did last time. Go over one by one and then see what we say. So the first question, what was the most surprising or interesting fact you learned about the birth of American dentistry? So one of the most shocking, surprising factors that I learned from that chapter was that dentists were extracting perfectly healthy teeth from people and paying them for it, and then transplanting those teeth into other people's mouths. And it's no wonder those procedures were unsuccessful, although they didn't have the science to back it up as to why. But I did not know that they took live teeth from live humans. I thought maybe like cadavers, or they made it out of like wood or ivory carving, I've heard, but I don't think I've ever heard of live tooth transplants. So that was shocking.
that is pretty shocking. I wrote down, and I really liked the story in the beginning about Harris extracting Dr. E or the doctor's tooth after he had visited the medical professional the day before and been like, okay, my jaw really hurts. Like, I can't open it, you know? And he was like, no, your tooth is fine. Like, you're fine. And then the next day he had it extracted. And so I feel like that was, I mean, there's still a discrepancy in the medical and dental world. And that was just kind of a good, I don't know, little story of, okay, they started to see it back then, okay, it did need to be extracted and it did make a difference, and infection does affect your body. So I liked the story aspects. I like the story aspects of the book at most anyway, but yeah.
Mhm.
Mine was just knowing the birth of the whole dental education. And so when they had the first own class was about 5 students, and it all occurred in 1840. So I thought it was interesting that they held it at the professors' homes. So it wasn't in an institution at first. So I thought that was pretty cool to see. I didn't think it would be held at a professor's home, and so I thought every education started at an institution. So that's kind of where I thought was interesting.
That is,
Yeah, for them to come from like peddlers on the street, like,
yeah,
I'm here in town, like the show is here, we could get some dentistry done.
Yeah.
That's crazy.
it is. And I think the book had a lot of good little facts in that chapter and a lot of good little tidbits. So yeah.
Even at the dental hygiene profession, I didn't think they would have so much resistance to that profession as well. And my goodness, there like this whole chapter wasn't just about the history about dentistry. It was a lot about discrimination and also sexism, especially in the dental hygiene profession, because they thought they need to have female hygienists because if they had men, it was prohibited because they would be more likely to pose competition to the dentists. And so I thought that was just very interesting how that played to part. I was always curious why there's so many female hygienists.
Yeah, I agree. And it's always kind of a rarity, at least like at the school in Montana, there's always like one guy or no guys or something like that. And so it's a weird, my class didn't have any guys and
Uh-huh.
class below us did, but I was like, that's really cool. Like, I wish, but there's definitely, you're right, a huge gender difference there.
Mhm.
Yeah.
I wonder if the same thing happened in like the nursing profession, because it's like, oh,
Yeah.
these women can aid you.
Yeah.
They have no ambition. They'll stay in their seats.
Yeah. I mean, it's kind of the truth though. Dental hygiene, nursing, you find a lot of females.
Um,
Yeah, I mean the our dental hygiene, the original name was dental nurses, but they changed it like I believe like 70 years ago.
A while ago, yeah.
Yeah, that was pretty. I'm pretty sure it's the same concept.
Right.
yeah.
We're all nurses here.
Yeah.
Nurses of teeth.
Yeah.
Mm.
I've been called a dental nurse before. Oh, does your nurse, you know, I'm a hygienist. Thanks. Yeah.
You're like, same thing. Yes, I don't know.
Yeah. They don't care. Yeah, yeah, yeah. That's a
Oh,
okay. So are we ready to move on to number two? I don't want to move on.
I think so.
Okay. Number two, Diamante Driver and Mame Ajay.
Good work.
Butchered that. The beauty pageant winner in chapter one are both from the state of Maryland, a relatively small state compared to the western states. In fact, their two towns are only 35.5 miles apart from each other. Does the differences in the focus of care that these two youths receive shock you? Um, it did not shock me that they received two different, completely, different quality of care at their appointments, because I see it all the time, every day where I live. I can drive down in the suburban areas of Sacramento. I live in a little suburb of Sacramento called Elk Grove. It's really nice. We have a ton of up and coming dentists here, all fee for service, private insurance. We don't have dental clinics here, but like, from the state or anything like that. But if you go just 5 miles up the road, you have these wellness clinics, you have dental clinics, you have the emergency services, the Medicaid offices, not privatized healthcare, and you get a completely different experience there than you would get here in Elk Grove. And we're a couple miles apart. So it's something that I see all the time. And when I temp, just going to the different neighborhoods in Sacramento, you can get a, a wide range of quality of services from one office to the next. I was just telling another hygienist I temped at an office that the majority of their barn hearts had one side.
Oh,
So I can't even flip them and get this, the
that's
mesial. Like it's like, what is going on? You don't even care to have quality instruments. What are you doing to your patients? And then I go to another office and they have state of the art dentistry, all the PPE, all the things. Patients are well taken care of. And a lot of times it's just based on what neighborhood you're in. So it's not shocking to me, unfortunately. It's very sad, but
that
it's
is
common.
crazy. And I just kind of put that it was a little bit shocking. It's always sad, and I always feel that, oh my gosh,
Yeah.
it's shocking for me to hear that, they only had one side of the barn hearts. But I definitely think it boils down to the fact that she went to a dental practice and he ended up in the ER. I guess that goes to show, like, of course he didn't receive great dental care. Like, he went to the ER. There probably wasn't a dentist. They probably didn't know, just put him on antibiotics and he'll be fine. He'll go to a dentist eventually. So I just figured that, if he had gone to a dental practice, right off the bat, they probably would have been like, oh yeah, that needs extracted. We're going to take it out. Hopefully, I guess, but so I figured that it was mainly their difference in care was because of different types of offices, different types of care.
You saw the difference in care based on the facility.
Yes. Yeah.
Gotcha.
My point is basically just like yours. Not finding it shocking. The one thing I'm a little kind of perplexed is there's usually maxillofacial surgeons in every hospital, and they are trained to extract teeth. So why aren't they pulling out teeth?
I don't know. Like, I live in a really small community and there's no way you'd find a dentist here.
Yeah. I
In
mean,
a hospital?
Yeah.
oh wow, yeah. I mean, other than that, just I am not shocked because even when I volunteer working in different state of the art dental practices or even working for corporate, everything's different. When I volunteered, the thought is to do best as you can. Every patient needed quads, SRPs, and I need like good 4 hours to do the whole mouth. They're like, well, do the best you can. You have in an hour. I'm like, what? Like something is better than nothing. I'm like, just leaving the residual calculus might actually cause more harm. Abscess maybe, and so unfortunately, I'm not really surprised because I've seen it so often.
Which is sad.
But yeah,
It is. I've had a really probably, I mean, I've done the like volunteer clinics at California Care Force. We go and we see all walks of life, and you see some of the hardest cases that you've seen since dental hygiene school when you're looking for those cases. And this lady walked in and it was like chunks of calculus under this bridge. It was a really needy SRP. It was very involved. And I said, I need 2 hours for half this mouth. And she's like, you have an hour. I don't know what to tell you. If I give you the time that you need to do the things that you need to do, we're gonna lose money. And I said, it's not all patients like this. It's a roundabout, it's an all like at the end of the day, did you make money, not lose money? Like, so I get the financial aspect, but the quality of care shouldn't be diminished because of how much you can pay. Like Demonte Driver's parents probably couldn't afford, his treatment. So he doesn't deserve to get treatment because he can't afford it. This patient didn't deserve my quality of care, the best care that I can give her, because the doctor couldn't afford to pay me my salary for the hour. I mean, we do make more than the average hygienist in California. We make about $50 to $60 an hour. But, and this patient's insurance just I think it was like a couple $100. It was like a low insurance plan. And she was like, I'm going to be out money if I give you 4 hours for the mouth. I just can't do it. Like, it's hard to hear, but we try to do our best. And in situations like this, we get turned down.
Yeah.
So we can only do what we can do. It makes you feel kind of helpless.
It's sad. It is, because it's hard, because what do you do? Then you do your best and try your best, but at the same time, you know that you're probably not providing them with what they need, you know?
Or
Right.
I tell them go to the dental hygiene clinic. They'll either get was
Thank
it
you.
$25 per quad, or they'll do it for free, or get paid to sit on the chair if a hygiene student's desperate enough for them to be in the chair.
Yes,
Yeah.
exactly. And they'll
Right?
love you for sending them that person. Yeah.
Yeah. It's rough. It's rough.
Mhm.
Okay, so number 3, the fear of dental hygienists expanding practice has been a longstanding fear of the dental profession. Has this changed at all in the years that you've been practicing? Could a dental therapist model prevent deaths like Diamante's? Um, I was shocked by one of that last, I think it was like the second to last chapter, something in assistance, and I forget what it's called. What is it called? Adventures and Auxiliaries.
Yeah.
Um, that was like, oh my gosh, they're saying everything that I've been complaining about for the last 15, 20 years in dentistry. But dentists don't see my point of view on things. They typically look at practice and money, and their practice model. But I also felt validated by this chapter because they were saying the things that I've been feeling. Um, Fears and wishes that I've like long carried for dentistry have been shown to be the same problems that we faced for 100 years that were presented in this chapter. So it makes me sad that the fight for the right to health has been so hard and it's been such an uphill battle that we have the same problems today that we had 100 years ago. It may not be the implementation of dental hygiene, but it's the continuing access to care issue that we've had this whole entire time. And we have evidence to back it up, and we have numbers and statistics, but because it violates the American dream, that right to make money, that we've had this idea, and the book really highlights that we've had this, you know, it is a trade. And if we violate a dentist's right to make a profit or his right to living, that is perceived as more important than, poor people's access to care because they can't afford it. So um, I was kind of yelling at this chapter, feeling really frustrated because if a dental therapist had been in the situation, if a dental therapist was available in that hospital setting, it could have prevented a death like Diamante's if the services were available through a dental therapist. They could have extracted his tooth. They could have given him a prescription after that extraction to eliminate the bacteria, and then we don't have that infection, hopefully. Um, but it is one of the cases where, unfortunately, he's now a martyr. He's an example of why we need a huge change in our system.
Yeah, I agree. And I think that them covering dental therapists was just kind of a thing that hit home because we talked about it in class and in a discussion, and they talked about it in the book. And right now, Montana, ugh, with all of our rural communities, dental therapists are something we just need, because there's so many small little communities that don't have dental offices. So then you travel 2 hours, to the nearest dentist, and that just does, so there is like a limited access permit, which doesn't quite, I mean, you don't have great services that you can provide really. And dentists really want to remove schools from the lists of places they can, uh, hygienists with their LAP can practice, for money. They say they're taking away business. But so it's actually in legislature right now, and it's this really big fight. But it is. I don't know if like I don't know if Montana will ever get there, but we could definitely use dental therapists. And I do think that they could prevent, deaths like Demontes and stuff like that. But it's just kind of crazy that you take 2 steps forward just to take 1 step back. I feel like hygienists are constantly fighting for more privileges and rights, even if that means more school or more, it doesn't matter. Set your standards, but they need care somehow, and somebody needs to provide it. And dentists aren't going into, the hospitals, at least here and stuff, and providing it. I have a really cool position because I work for a community health center here. So I have the ability to I go into our school here, and I go into nursing homes here. And we have like a palliative care program. So I go into a few of those people's homes that their families want, their parents to receive dental care and stuff like that. And that's really cool. So you can take x-rays and send it back to the dentist. And
Do you have an extended licensure?
I do. I have my LIP, but also just working in Montana, working for the community health center and under their supervision, you can do that in Montana.
Oh, wow.
Yeah, which is kind of cool. So
Cool.
if there were only more of us. Yeah.
Yeah.
Yeah. So hopefully someday Montana will get there though, because I can't like extract teeth and stuff like that. They just haven't expanded the functions that far. And who knows if or when they will.
We have an AP license, an alternative practice license for hygienists in California. But as progressive as California is, we don't have a dental therapist because it's been fought every single time. I go to legislative day most years to lobby for hygienist causes and the things that we want implemented that year. And we finally had a breakthrough. And guess what? It was over. We can now give, without supervision, fluoride varnish.
Yes.
Good steps.
I was like,
Yeah.
That's really bad.
it's a step, but like you were saying, it's like little step.
Yes.
But underprivileged, and you can't serve underprivileged people. Varnish, we'll give you that.
You do like silver diamine fluoride?
You have to have like a certificate, and we can do interim therapeutic restorations if you have an ITR certificate, but there's not a lot of programs available in California yet, because you also have to have a licensed dentist there and going with you through the program.
Not that even.
There's a lot of obstacles.
Yeah, seriously.
To getting continuing education, to getting continued licensures, to increasing what we can do with our licensures is a lot of opposition.
We're just like stuck in a little bubble.
Yeah, but we're going to keep pushing.
Yeah. All right. What about administering local anesthetic? Does the dentist have to be on site or?
No, not in Montana.
Okay.
For in California, the dentist has to be on site. But if you have your AP license, something that just passed this year is that, which isn't going to be implemented for the next year and a half because the dentists have to write the guidelines on it, which is kind of funny. And then they present them to the dental hygiene board, which is who supervises us. So you would think the dental hygiene board would write these, but no, it has to come from the dentist. So they give this to the dental hygiene board who supervises us. And then they say you can give, so alternative practice hygienists, if they have that special license, they will be able to, in the next year and a half, administer local anesthetics to their patients at home. Because right now they can use like Orachix and topical gel and things like that, but they can't anesthetize patients without a dentist on site. And typically you're going to people's homes or nursing homes, like you don't have a dentist on site. So all it requires is that a dentist supervises your license in some way. So it could be a surgeon, it could be, I mean, it could be a chiropractor. So, uh-oh, we have did you just get that message on your recording?
Just said we got unlimited time.
Oh, it said unlimited?
Yeah, we're giving you a
Oh.
gift of 40 more minutes or something.
Oh, thank you, Zoom.
Great gift.
Yeah. So that's exciting that we'll be able to give local anesthetic in home to like people with MS or, you know, who are bedridden and they need that quality care, but they can't have it. So
Yeah,
yeah.
very cool. Slow steps.
Yeah. What about you, Jessica, for number 3?
So what I wrote down was, so even ever since I was in hygiene school, there was talks about the dental therapist profession about what, 7, 8 years ago. And so every year there's a push. I think we finally went through the breakthrough in 2019 that they were able to introduce a dental therapist in legislation to get that traction. Of course, we're still kind of, still getting defeated on that, but
You're in Washington, right?
yeah, I'm in Washington. So I spoke with a senior professor, Eastern Washington. I think it was Rebecca. And so they have the dental therapist protocol, the whole course. They have it all in handbook. Everything, the course is ready to go. They're just waiting for the green light, and they're going to start accepting students as soon as we get that law passed. And so that's been going on for 8 years. And so I I don't know, just as frustrating it is, they have this whole book and it's all to the side. It just gets frustrating to see that so many dentists, even who I work with, they still oppose the dental therapist because they're going to lose money. And so I think it's just because there's lower reimbursements rates coming right now as dentists that they're facing. With crowns used to be 100% covered, now it's like 50 or less. And so I think they're just worrying about that aspect. And I thought that my only concern about dental therapists is, what if some of them do go into rural countries, but what if, or sorry, cities, and so what if they end up working as an associate for a dentist and actually making more income for the dentist? It might be cheaper to work as a dental therapist rather than hiring another dentist. So that's my only concern about the dental therapy integrate in the system, but I think they can definitely do more good than harm, just in general. I think there's just going to be, all around. It's going to help everyone. It's just my concern is just the whole dentist. They're all positioned to that, and some of them taking advantage and not hire other dentists. And I know that some dentists are having a hard time finding jobs or the income, where hygienists are getting paid more than dentists right now because dentists don't have a lot of patients with DK coming in private places or private insurances that they accept. And so I just don't know. I just think that their job alone is going to be hard for them to find as associates for sure.
It is a strange, thing, but I think if they put hopefully if they put restrictions on it, like, okay, you can extract, but it can't, you can do a surgical extraction. So if it goes surgical, you need a dentist, or
Exactly.
yeah, hopefully they put enough restrictions on the, I mean, everything needs restrictions, or only, you can only fill a certain number of surfaces, or you can only, so hopefully they're strict enough about it that you're not losing, they create some sort of solution for that.
Yeah, one of the fears they talked about that the dentist presented in the book was that their job, kind of like you said, Jessica, would be just restricted to just doing that specific portion. And so they're taking this huge amount of, kind of like drill and fill dentistry away from the dentist and leaving them with just extractions and crowns and root canal or, surgical extractions, crowns, root canals. I think on the dental therapists, the one when we were looking into the Texas, like they can do the drill and fill, they can do certain types of restorative procedures, but they can't do the more involved procedures like a root canal or a crown or bridges or, any prosthetics or things like that. So it's limited enough, but When you have like someone like an RDA EF2, which is an assistant with like a higher level, like an RDHAP would be, but they have specific training in, the dentist goes in and drills the decay out, and then the assistant comes in and packs everything in and then fills it and then uses the drill to carve it. So they're doing everything but drilling. And this person doesn't have any of the training that we've had as hygienists. But that's okay because they have to do it under a dentist supervision and they have to be hired by a dentist. So the dentist is now making money. So they're perfectly fine with an EF2, and more EF2s are being hired because if you could just go from room to room and drill and drill and drill and drill, and you have someone coming in behind you to take up the rest of the 45 minutes that they need, then your time for production is like boom, boom, boom. And I've seen EF2s. I had an EF2 at the last office I worked at. She made more than me as a hygienist. And I already have, 5, 6 years now of college under my belt and 2 degrees, working on a third. I have all these certificates of education. And she goes in, learns how to do this one thing, and can now do most of what the dentist can do except for drilling. So they like that because they can have them in office and control the money, but they don't like when we work independently. That's the only problem, is they can't control what a dental therapist can do without them. They need us to need them so we can function. And it's been a long standing, and it was highlighted in the book as well, that it's been a long standing thing that it's written in law that they need us under their licensure.
Mm-hmm.
And I found that very amusing and frustrating that they would write into these laws that we need to be supervised at all time. When dentists they get like 2 or 3 weeks of hand scaling. They don't know what the scalers are called. They don't know how to scale. They don't know how to do our job, and we don't know how to do their job. But it's amazing that they supervise us and they have to manage us, even though we have a separate licensure and a separate educational system that allows us to do our job perfectly fine without their supervision. So it's my rant.
It's all good.
Yeah. Okay. Did you have anything else to add, Jessica, on that number
No.
3, I think we're okay.
On 3. I know that's pretty much it. Yeah.
Okay. Number 4, the average dental hygienist is 30 years old, female and white. Pretty much sums me up. I'm 35. Does the profile of dental hygiene work population impact the care that minorities are receiving? I had to stop and think about this because even though I'm white, I'm in my mid-30s, female, and I fit in this demographic, I strive to have an appreciation and understanding of other people's cultures. I seek out those types of continuing education classes every 2 years and get like a cultural dynamics aspect or cultural communications in dentistry. We have someone in our area that does a great lecture. I think her name is Tony Horvath, but she, I may be mistaken on her name, but she wrote a book and she has great information and lots of cultural experience, and she's a hygienist. So continuing education helps us create that cultural dynamic in ourselves and understanding in ourselves that we wouldn't get growing up in a white family or in a Caucasian family. I may not always be the best at meeting people where they are and their culture, but that's just my inexperience. But my quality of care is not distorted because I'm white and others are different from me. But I know that people like to be in an inclusive environment, and when they don't see people of their own ethnic background, it may deter them or diminish the desire to seek care from someone that they feel may not understand them personally. So I do understand that aspect. We like to be around people that are like us, either emotionally, or physically. it makes us feel comfortable to be around people who are like us in whatever aspect that is. So I can understand that there may be a difference. I just don't feel like I change my care based on someone's culture or appearance, or at least I try.
Yeah, I agree with you. And I can definitely see where people feel uncomfortable, coming into an office that is all white or all, but in our book, and I wrote down the statistic, it's, said that while more than 12% of Americans' population is Black, fewer than 4% of America's dentists are Black. So I feel like it's hard to find a dentist of, your same ethnicity. I work on a reservation or really close to a reservation. And one of the first weeks I was there, I had a lady come in and she sat down in the chair and we're going over medical history, and she looks at me and she's like, "You're not native." I'm like, "Well, no, I am a very white redhead. Like, I am not native." And
How do you know?
yeah, can you tell? But and it just kind of, so I could tell like she was a little bit uncomfortable that I wasn't native. But
Mm,
it's okay. I think that the more comfortable they get and the more they come back and realize you're just a person too, it helps. But there is that getting them through the door and, lack of insurance and all those complications that come with it. But I think that with the amount of, 30-year-old white female hygienists, there just aren't many options. And it probably is intimidating, but I don't think care decreases. You'll try to look at everyone as the same, and it's a mouth. Okay, so you need everyone individual anyway, you need this care, you need this care. But that's a tough question. I don't feel like there is a yes or no answer because I kind of think it's an individual feeling and the patients get to kind of make that feeling, too. Like, do they feel comfortable?
yeah.
So in terms of what I thought for dental hygiene work population impacting care, so regardless as a hygienist, it doesn't matter what race you are, what sexuality, what language, what color you are, you should still treat the patient because if that bothers you based on their orientation, whatever they are, you're simply in the wrong profession. I think we as clinicians should be taking care of our patients. Even the Hippocratic, the oath says, "Do no harm," and so this is for physicians, but I think every clinician should do that. Same goal is do not promote any harm. And so, um, I know that every person's different. They have different perceptions, and so not all hygienists think that same way, but I've definitely come into contact with those that did not feel comfortable as because I'm Russian, and so I used to go in Eastern Washington to live out there for a bit, and I was told not to tell people my race. Just your first name and last name is white. Just stick with white. Don't say Russian. And
Really?
so,
Somebody told you that?
yeah, the manager told me that, and the owner.
Oh my God.
And so it was mostly just like, it was out in the country. It was mostly Hispanics and whites. And they hated the Russians for some reason. But I don't know. And so I just made a joke about Russians and myself, just kind of laughing about it. And I'm like, yeah, I'm Russian. And so that patient just made the biggest complaint that they didn't want to see me just because I just threw a joke and I was just making fun of myself about it. And so oh gosh, it was just about me being so white as a Russian. I can barely tolerate the heat. I don't remember what the joke was, but it was just 110 degrees.
Self-deprecating humor, lighten the
Yeah.
mood.
I don't
Yeah.
know because I'm brag. I was just making fun of myself. Like, I don't know how you guys can handle this heat. Like, I'm dying. Like my Russian pasty self. And so I found that very, very weird. But like, I think in terms of building a relationship, I think as a clinician, I think what you mentioned earlier is just having that what is it, therapeutic communication with your patient, it can get diminished because we don't understand cultures. I know like the Chinese culture, they believe in like the yin and yang, the hot and cold, what is it called, if you take too much stuff out of their mouth, such as too much calculus, they'll disrupt the balance. And so I don't know that until I have gotten some friends who are Chinese and they're informed me about their beliefs. And so I am not up to par with all ethnicities, but I do live in an area where I do go to community colleges, and community colleges are notorious for being very diverse. For one, I grew up in Tukwila, which is the #1 diversity in the Pacific Northwest. So diversity, I'm very diverse in it. Plus, I don't really coincide with my own kind. I don't know why. I just hang out with all types of groups, African Americans, Asian, Chinese, Koreans, Filipinos. And I got to learn slowly over time different cultures. Some want you to talk more. Some of them find jokes are rude. Some of them find you asking questions. You just kind of pick it up by nonverbal communication and learning where they stand. And so I believe for care, I believe every hygienist should provide the best care possible. That shouldn't bother at all, whatever race, ethnicity, sexual orientation. But in terms of just having that trust, having that bond with the patient, I think that does come into like challenge with cultures, because we have different struggles. And sometimes I won't be able to understand it because of the discrimination that those and the stereotype that the world has put out. So,
Right.
It's all about building the knowledge of all the different cultures and gaining that experience. And you've got a lot. You're doing good, Jessica.
I also wonder that if the average age of the dental hygienist is 30, does that have anything to do with the burnout in our profession? I mean, you can't do our profession. There's very few hygienists in their 70s. My grandmother was one of them, still practicing 1 day a week, but there's not a lot of older dental hygienists because it's such a wear and tear on your body. So I was thinking, well, maybe the average age is lower because I mean, we start out at a young age and then we only work till like 40s and then we find something else to do, or, 50s or whatever, or it's just not a profession that was like it's used to. You don't have retirement, you don't have benefits, you don't, if you're part-time, and it's so demanding on your body that it may take you out before you're ready.
Yeah.
So I was just wondering, I wonder why the average age is. I wonder if it's just because burnout or physicality. All right, I think this last one. What have you taken away from this book so far that has changed the way you view oral health? A lot. I made a little list here. So there's concrete knowledge of our evolutionary history. So I've taken away from the book a lot of history about how we started. You learn a little bit in dental hygiene school about, phones and Irene Newman, the first dental hygienist, and all of these amazing things, but you don't hear, wow, like some of these women went to dental hygiene school, graduated, finished the program, and were never allowed to practice. Like, that's crazy. So to know that the profession has been struggling since the start is kind of amazing and shocking. So concrete knowledge, having a valuable knowledge of our history is super important. Validation that others feel the same way that I do about dentistry, needing to be more accessible to all. I grew up in a strong Republican household in California, which is odd, but I've just been taught that privatized healthcare will give you way better, systems than a public. You can't even trust the public to give you, great private or great public school systems. How can you trust them to give you great healthcare systems? So I've grown up with this mindset of privatized is better. And even in dentistry, they tell you privatized is better because public health is such a tragedy. It's such a terrible place to be. You'll never get good quality care in public health. You have to come pay us for our services because no one else can do it if they don't charge this much, kind of thing. So I've had this ingrained in me. And the more I start to move away from that and just kind of think, well, that's not really what the evidence is showing. That's not what we're seeing outside of private practice. And when you do that, you ignore this whole 50% of the public, who's not getting care or whatever, and all these children. So I'm just glad that the book is creating some validation for me and how I feel, and moving away from those just ingrained thoughts that things are this way and they have to be this way and there's no other way. It makes me feel empowered to make the necessary changes and change the system. I'm kind of a fighter, so I will fight for dental hygiene. I've been on the dental hygiene board since I started, just trying to give back. So I try to make changes and help promote changes in the dental hygiene system. So I will continue to do that because it's needed, and especially this chapter that I was yelling at. Like, I know. But it also makes me scared and nervous that hygienists won't be able to create the change that's needed, because it's just been this long fight. And it's like, well, how are we now going to make a difference if they've only made these small steps and small steps? But I don't want to get discouraged, because small steps are still steps.
Yeah.
And eventually they will lead to the place that we want to be if we just keep pushing forward. So um, the book is empowering for me.
I agree with you. And I think it's a really good, you touch on all of these things in hygiene school, but then you leave hygiene school and you go to work, and this is me going back to school. So it's kind of cool to bring all this stuff back up, through a nicer book than opening a textbook and being like, all right, chapter 1, this is a little bit nicer to read a chapter book that flows a little bit better. Some of the chapters have been very confusing, but and not flown well, but most of the time, it's nice. You get little stories and little extra tidbits and stuff like that. But I just kind of, put some bullet points, like it touched on access to care and racism and lack of dental knowledge and the history of our profession and all of these things. It just kind of gave a different perspective, and it hits home because they're huge issues to us. So it's been fun.
Yeah. Do you find yourself bringing stuff up at work or relating new findings to like your experiences at work as you go?
A little bit. I asked after, we talked about Demonte, I asked one of the dentists, I was like, do you remember this? And they both did. They were like, oh, yeah. And so it has brought like just little topics, even while I'm reading. Sometimes if I have a patient no show, I'll be reading the book there and I'll be like, hey. So yeah, it has.
Oh,
Yeah.
How old are your dentists?
Uh, One of them is like 50s and one's 40.
Okay.
Yeah.
this didn't happen too long ago. It was all over the news. I remember it like clear as day. I'm like, how could they let this boy die?
Long ago. I don't remember what year was it again? 2007?
Mm,
I already
it
forgot.
was in the early 2000s, maybe 2010.
Something like that.
Why? Okay.
So it
I
wasn't
mean,
that long ago.
well, I know this Russian truck driver had a toothache, and he's like, oh, his wife was like, no, go get it fixed. He's like, no, I'll do it when I get back. So he dropped off a load all the way to New York and never came home because led into an abscess. He was actually from Sacramento. This happened 3 or 4 years ago. And so I've heard about this stuff happening in the Russian community, but not as often. And so this whole Demonte, it was the first thing that I heard. I was like, what? Oh my gosh, this actually made history. I'm like, what about the truck driver that left the mom with 3 kids at home?
I hadn't
Right.
thought that, but that's also very crazy.
Yeah.
Trying
And so, I mean, what I've taken out from this book was there's always going to be resistance when there's change, even with the whole. I originally want to be a physician assistant from a long time ago, and I got into it and learning about how much resistance it was to create the masters of nursing. So that actually got rejected first. And so they were able to fly under the radar as being physician assistants as a super nurse during, was it World War II? And so they were able to get by because of the needs during that time. And just because they succeeded, they had to prove themselves, then they were able to still fight. And then eventually they got in their place. It seems like every time there's change, we have to prove it to them. What are the numbers? How are we improving this? And then we'll earn our place, which is a little frustrating, especially knowing, what is it, Shoen? Is that how you say it? Towards the end of the chapter, he says the ultimate clash between dentists is the long-term liberty and the public's equity. And it's true, and it gets so frustrating. And so
we watched a CBS video how supposedly we have the best healthcare, but really our healthcare is crap.
Oh, that was a good video.
Was a
Yeah,
good
in
Yeah.
comparison to Taiwan and China and was it Japan? Like how even Sweden, like how they did healthcare. And so they really do put emphasis in the public's equity, but here
yeah.
it's not, and it gets so frustrating to me to see that why America, if we're so advanced, why are we so behind this? Is it because of the love of money? Is that we're getting screwed over? I don't know. I am just getting more frustrated as I read this. How corrupt America is, how our system is. I don't understand why other foreign countries are doing way better than us in terms of healthcare, and I think there should be a lot more emphasis in that.
I
Yeah.
agree.
This
Yeah,
book definitely
totally.
put a good spin on that too. And that video was really enlightening. It was a good video.
Yeah.
Yeah.
Yeah, I think it is about the money. I mean, it can't be about anything else when we show up with proof of how this could help or how other states have done similar programs and look where they at. Oh, and they're still dentists thriving and living and making money. I think I mean, I could see a balance between whether people want to choose privatized healthcare and go that route, or they pay into a universal system. Maybe everybody pays into a universal system, and if you want privatized care, then you can get privatized care through your employer. I think we can strike a balance between the two. It doesn't have to be all or one, like a lot of the countries in the video showed, in that PBS video, that they looked at viable options. Our country isn't even, it's either, full on public healthcare or full on privatized healthcare. And where's the money, you know?
Gonna take a
It
long
disturbs me. Yeah, it disturbs me that the primary concern is money. Let's create a good plan that can serve the needs of our nation and then look at sustainability. Let's get a plan and then we can work from there to see how unsustainable that plan is or how sustainable that plan is. But I mean, I'm not in the legislation. I don't know what ideas they're putting up or anything, so um, that's why it's so important for us to be lobbying with our hygiene association. Um, our California Dental Hygienists Association has like 2,000, maybe 2,200 active members. There are over 25,000 dental hygienists in the state, 2,000 members. So we don't have the support that nurses have at working at these large hospitals, and they can get together and unionize and say, we want this for our profession. So it's difficult for us to come together, and then we're all divided by states.
Mm-hmm.
When nurses can go,
Mm-hmm.
So hopefully we can follow on the coattails of nurses and demonstrate that, hey, we can do this too.
Maybe eventually.
Yeah, fingers crossed. All right, I didn't find it. I was looking up the quickly about when the Diamante driver thing was, but I don't remember what chapter. It was like one of the
I
early
wrote it
chapters.
in a letter, and I'm pretty sure I wrote it in the letter, our legislation letter.
Oh, yeah. Okay.
I wrote it and I don't even remember. Like, hello.
Well, maybe because you have more than one thing on your plate.
Yeah, seriously. 2007.
Yeah. Okay.
Oh, you're right.
You were right.
We're right.
Well, thanks,
Right.
ladies. Book group number 2.
Yeah, so we'll meet up on the 22nd, same time.
And if for some
Were
reason that
you
doesn't
saying
work,
the link
yes.
again? Okay, perfect.
And if for some reason that doesn't work, somebody shoot a message and we can always rearrange that.
Okay.
Sound good?
Good. I'm gonna stop recording here.